Hello everyone, I hope you are doing great today. Welcome back. And if you are new to my channel, welcome. This is Hong Nguyen, your trusted coding expert. This is the place where you can gain valuable knowledge from real-world medical coding experience. Imagine this, you are taking the CPC exam online. You've been pacing yourself well, and after 2 hours, you have already completed 50 questions, right on track. You still have another 2 hours to tackle the remaining 50 questions, and you are feeling pretty good. But then, reality hits. All the remaining questions are long operator reports with multiple codes in the answer choices. You start reading, but the overwhelming details slow you down. You glance at the clock. 5 minutes have passed, and you haven't opened your book to look up a single code yet. Panic sets in. Your mind starts racing. Your head starts pounding. Your mind feels overloaded, and suddenly, time is slipping away. This is exactly where many people fail the exam, running out of time. If you ever struggle with long cases, time pressure, and decision fatigue, this video is for you. Today, I'm going to show you how to tackle lengthy up reports efficiently and avoid running out of time so you can pass the exam with confidence. Let's get started. Now, just look at this case. There is no pre-op diagnosis, post-op diagnosis, or procedure title to give you a clue about what it is about. There is no clear indication of what procedure will perform. Instead, it's just a block of plain text filled with medical terminology. Then, you glance at the answer choices and see a long list of IC10 and CPT codes, and suddenly you don't know where to start. You are aware that you only have about 5 to 6 minutes to tackle this case. Now, imagine you never watch any of my training videos. How would you approach this case? Take a moment to think about it. Would you start by reading everything first and trying to understand the details? What if it is a complex case, like brain or heart surgery, and you have no idea what they are talking about because you are new to coding? How would you handle it? Understanding your struggle, I developed the reverse analysis method, also known as the backward approach. In simple terms, this technique means you don't start by reading the case. Instead, you focus on the codes in the answer choice first. By review the code description, whether IC10 diagnosis code or CBT procedure codes, you can get a clear idea of what the case is about before even reading the full question. With that in mind, skip reading the case for now and direct your attention to the group of code listed in the first column A, B, C, and D. A, B, and D have the same code, S82.842B, so they are in the same group. C has a different code, S82.52XA, so it belongs to a separate group. Now you have two groups with two different first listed codes, S82.842B and S82.52XA. I want you to pause the video, open Yashitensian book, volume 1, and look up these two codes to find out what they are about. Please do it now. Assuming you already looked them up in your IC10 book, here's what you found. Remember, during the AAPC online exam, you are no longer allowed to use a highlighter or writing tools. Instead, take advantage of the on-screen notepad to keep your course organized. I strongly recommend practicing with it, as it will help you structure your course more effectively and improve your overall thought process. That said, on the computer testing desktop, click Notepad to open the application. Then type the IC10 code decryption. Remember, you don't have much time to type the entire decryption, just a few keywords or main terms to help you see the difference between them. Based on what you just typed in Notepad, you have two codes: S82.842B, open display fracture of the left bimalleolar, and S82.52SA, closed display fracture of the left medial malleolus. After this step, based on the code decryption, you should have a general idea that this case involves an open versus closed fracture of the left ankle. The difference between these two codes lies in the anatomical site. Bimalleolar versus medial malleolus. If you are familiar with medical terminology, you should know that bi refers to two, so S82.842B, a bimalleolar fracture, refers to a fracture of both the medial and lateral malleolus, whereas S82.52SA refers to a fracture of the medial malleolus only. On another side note, if you have been watching my videos, you should know that the last digit in the fracture code is significant. A is for closed fracture and B is for open fracture. Understanding this difference will help you focus on key details when you start reading the question, such as whether it is a closed or open fracture, and whether the fracture involves the bimalleolar or medial malleolus site. Let's read it. A 65-year-old male presents to the emergency department after falling from a ladder at home. He complains of severe pain, swelling, and inability to bear weight on his left ankle. Physical examination reveals an open display fracture of the left bimalleolar ankle with visible bone fracture. X-rays confirm the diagnosis. Based on what I just read, this patient presents to the hospital after falling from a ladder and fractured his ankle. The X-ray confirmed it is an open display fracture of the left bimalleolar ankle. Therefore, between these two codes, S82.842B, open display bimalleolar fracture, is the correct code to report as the primary diagnosis or principal diagnosis for an inpatient encounter. That said, we can eliminate C from here. A, B, and D are still remaining, so we need to look at the next group of codes. Since they all have the same code, W11.XXXA and Y92.0, so we cannot use these codes for our process of elimination. Let's move on to the next group of codes. Now, you have a choice. You can either use IC10 diagnosis code, I10 and I11.0 in this group, or the CPT code 27814 and 27766 in this group, since they are different, and it will depend on your preference. If you are not as comfortable with CPT code, you can use ICD-10 to help narrow it down to the right answer. However, for the purpose of this training, I want you to focus on using the CPT codes in this case. A and D have the same CPT code 27814, so they are in the same group. B has a different code 27766, so it belongs to a separate group. I want you to pause the video, open your CPT book, and look up these two codes to find out what they are about. Please do it now. Assuming you already looked them up in your CPT book, here's what you found. Remember, you don't have much time to type the entire description, just a few keywords or main terms to help you see the difference between them. Based on what you just type in Notepad, both CPT code 27814 and 27766 are for ORIF, which stands for Open Reduction and Internal Fixation. However, the difference lies in the anatomical side. Code 27814 is for the repair of a bimalleolar fracture, which matches the correct diagnosis we just selected. Therefore, we can eliminate B from here. Now, if you have been following along and you're liking what you've seen and learned so far, please pause for a moment and click the like and subscribe buttons before we move on to the last step. A and D are still remaining, and the only difference now is that A has 11012 and D has 11010. Please pause the video, open your CPT book, and look them up now. I'll wait for you. Assuming you already looked them up in your CPT book, and here's what you found. Based on what you just typed in Notepad, both code 11010 and 11012 are for the debridement of an open fracture, and the only difference is the depth of the procedure. Code 11010 cover debridement down to the skin and subcutaneous tissue, whereas 11012 involves debridement down to the muscle and bone, and this will be your focus when you go back to read the case and determine the correct code. Let's read it. The orthopedic surgeon evaluates the patient and determines that the surgical intervention is necessary. The patient undergoes an open reduction and internal fixation (ORIF) of the left bimalleolar ankle fracture under general anesthesia. In addition to the ORIF, the surgeon performs a debridement of the open fracture wound down to the bone and remove necrotic tissue and prevent infection. Based on what I just read, the debridement of the open fracture wound was done down to the bone. So 11012 is the correct CPT code to report in addition to the ORIF code. That's it. A is the correct answer for this case. Here are the key takeaways. First, when working with complex coding scenario, it's important to break down the case step by step to narrow down the correct answer. Second, in case with multiple codes, using both IC10 and CPT code can help you with the process of elimination, especially when the code differ in the answer choices. Next, when coding fracture, be sure to focus on key detail, like whether the fracture is open or closed and its anatomical location. And lastly, for fracture codes, remember that the last digit can indicate the type. A is for closed fractures, while B is for open fractures. That's all for today. If you found the content valuable and would like to see more for your exam prep and everyday coding, don't forget to click the like, subscribe, and share buttons. I spend time creating case studies to help you master these techniques. Remember, the more you learn, the more valuable you become. Keep pushing forward and growing. Until next time, have a great day.